We've come to the final segment in our mini-series around sexual health with Dr. Mark and Sister Elise. And today we're going to be talking about some of the treatment modalities available for sexual dysfunction in women. Mark and Elise, great to have you back with us and wonderful to finalize this discussion. Mark, last week we spoke about the various issues that women are dealing with when it comes to sexual dysfunction. And you mentioned that most of them are treatable, if not all of them are treatable.
Yeah.
So what are the processes that we would be looking at in terms of treatment of sexual dysfunction?
Michael, treatment's going to depend on the underlying condition.
Right.
If we, for instance, take a look at the 4 different types of sexual dysfunction, we start with interest desire disorder. Here it's usually because of 2 main things. Well, let's make it 3. You have hormonal influences, underlying conditions for hypertensives, the depressives, the anxiolytics, and then one of the other things that we cannot forget in this department is specifically the sexual traumas.
Okay.
Sexual abuse, bad relationships, etc., will downregulate the libido. And the treatment modalities that we will use for these will differ according to one of those conditions.
Right.
On the hormonal side, the best treatment for hypersexual desire disorder in women is testosterone. When it comes to the medications and the other medical conditions, we need to think about either changing the dose of the medication or changing the medication if it's possible.
Right.
And when it comes to the trauma situations, now we start thinking about psychotherapy, cognitive behavioral therapy, a visit to a sexologist, etc. So it really depends on what the underlying condition is. The second one, we talk about the arousal disorders, where the body doesn't get physically aroused. Here, you need to look at what is the underlying cause. Again, is it medication? Change the medication. Is it a hormonal influence? Change. So arousal disorder is a little bit more difficult to treat. It's usually with a sexologist. Would you agree, Elise?
Yeah, I do agree, but I think it was also combined, the interest desire disorder and the arousal disorder in the clinical practice is a combined thing.
Okay.
You can't differentiate between the 2.
Right.
So if you don't have interest and desire, the body won't respond.
Okay.
And then that's the problem. You need to treat that condition together.
So it's very much a holistic approach, because you need to be looking at the bigger picture. What are the influences from all angles that may be having an effect?
Yeah.
Michael, you really you need to have a very clear understanding of a patient. Medical history, current medical conditions, medication, psychological history, trauma history, etc. And then you need to do a full-on physical, because there can be physical conditions that's leading to this. And if you don't have that, you cannot progress to planning the treatment, never mind executing the treatment.
Right.
And I want to add, one needs to do a pelvic examination as well.
Right, okay.
To see if there's any physical problems like we discussed previously, the pain disorders.
Mark, in terms of treatment of the more physical things, is that also, imagining some of them would be somewhat invasive and uncomfortable?
You know what, first and foremost, you have to go and diagnose those conditions. And that usually will involve some kind of investigation, usually a laparoscopic investigation or a cystoscopy, where we actually take a look at what's happening in the bladder. Very slightly uncomfortable. It's done under general anesthesia. It's over fairly quickly. Some of the other pain conditions, the vaginal pain conditions, specifically vaginism, here we're treating them with neuromodulators.
Okay.
Where we literally inject a botulinum toxin preparation into the tissue. It relaxes the muscle and it changes a woman's life.
Right.
When it comes to the dryness conditions, the vaginal dryness of the mucosal atrophy, here we start with a combination treatment. It's optimized for hormones, whether it's systemical or local. But we also have platelet-rich plasma therapies, PRP, that we can use for rejuvenating. We have a couple of products on the market for vaginal rejuvenation.
Basically stem cell products,
Right.
preparations that is applied locally, vaginally, for rejuvenation of the mucosa, etc.
Yeah.
Michael, I think one of the conditions that women really do not discuss is for orgasmic disorders. Here we're specifically thinking of platelet-rich plasma therapy.
Okay.
So women can start achieving an orgasm.
Okay.
You know what? What's the use of running a race and there's no prize at the end?
Absolutely. How are people's lives affected when they come out of this cloud of dysfunction into a normal functioning sex life?
I'm going to tell you what one of our patients said to us. Both of them, they're in their 50s, very successful, very hardworking, very stressed. When they came to us, both of them, nothing. Their sexual life or sexual well-being was dismal. And they've been on treatment now for about 2 months. And they sat in my office and they said, you know, we're bonking like rabbits. And that came from the wife.
Yeah, yeah.
Who was very quiet.
It's just, oh my God, suddenly our relationship, our personal relationship is so much better.
There's such a disconnect because people think, and again, it's almost I almost want to say it's a taboo because it's sort of the accepted norm that as you age, sex is no longer an important part of a relationship.
Michael, you say that one of the highest incidences of sexually transmitted diseases happens in old age homes.
It's not something I would have expected.
Seriously, because of Viagra, of hormone replacement therapy, of sexual aids, etc., etc. Older people are sexual. It's good exercise for them. It releases endorphins. You know what? They are beyond that time where they care what other people think. So, you know what? It's a natural part of life, and we should see it as that.
Now we just have to maintain the sexual education in terms of safe sex in the retirement.
Well, that's a bit of a problem.
Anybody who's looking to get some more information, remind us again where they can find you.
Telephone number in Johannesburg 010-824-1393 and our website www.tclinic.com.
Mark and Elise, thank you so much. I think it really is. I mean, I think towards the end now it's become a light conversation, and I think the more people are comfortable to talk about it, the more it will become a lighter conversation.
Absolutely.
So that things can be done. So thank you for sort of breaking that taboo. It really is such a pleasure to have this discussion with you both.
Thank
Thank
you,
you,
Michael.
Michael.